Dr. Motlagh, thank you so much for joining us here on Health Connection. Our topic, Botox and Juvederm, looking younger has never been easier. Cosmetic procedure we're talking about. Cosmetic procedures used to be just for the rich and the famous. What's changed?
What's changed is the perceptions of society nowadays, that people are looking at fashion magazines, television, other ads, and they want to measure up to those standards that they think are the elite, so that they want to look as best as they can, feel about as good as they can as possible.
Botox is a name we've heard many times. Juvederm's a relatively new one. What are these medications? How are they used, and how are they different?
Botox has been around for a while. It was used initially to treat lazy eyes and spasms of the neck initially, and then more recently it became FDA approved for use of wrinkles in the area between the brows and now other areas of the face. So that's been around for a good 20 years or so. The hyaluronic acids have been around for maybe about the past 15 years. Those are the Juvederm family, for example. And they're used to fill in lines rather than weaken muscles.
Okay. Walk us through a procedure, Botox or Juvederm. What happens?
What happens is first they have the initial consult to see if they're candidates for it. And then we probably do the procedure on the same day. Botox injection itself probably takes about 30 seconds to do. The Juvederm may take maybe a minute or so to do. So they're very quick procedures. The Juvederm, you can see the results instantly, and the Botox takes about a week to see the full effect.
What are the most common reasons that patients want Botox injections?
They want to look younger without undergoing the knife, and it's the most powerful, non-invasive procedure that can be done.
How long does the medication last?
Botox lasts on average 3 to 4 months, and Juvederm, depending on the area of the face, will last anywhere from 4 to 12 months.
Botox and Juvederm normally used to remove wrinkles and creases. Any other uses for these drugs?
Yeah, there's, for example, the Juvederm can be used to correct a hump on a nose. It can camouflage it. It can be used to cover lines anywhere on the face. Some of those are FDA approved, some of them are not, and we always tell patients if they're off-label. The Botox can help with some banding of the neck, for example, in early cases. Botox can be used to help people who sweat a lot on their palms or in their armpits, for example, and it seems like every year they're finding out more and more uses for these.
What's a normal emotional reaction from someone who's gotten a Botox or Juvederm injection?
Usually it's pretty dramatic with the Juvederm because you see the result instantly. One minute you see the wrinkle, next minute it's gone. So when they look at themselves in the mirror, sometimes the mouth opens and the eyes get wide and a smile comes on their face. And with Botox, usually that happens about a week later.
How affordable are these procedures, and what can someone expect to spend at current prices?
Yeah, Botox costs less than Juvederm because it lasts about less, 3 to 4 months. Botox on average costs about $300 per area. Let's say this is an area, this is an area, this is an area. Juvederm costs about $500 per area, and it lasts about a year.
Okay. Is there a recovery period for these procedures?
There's almost no recovery period. There's almost no downtime. People can just go right away into whatever they're doing.
If someone's interested in removing wrinkles, how should they proceed with respect to getting Botox or Juvederm?
They need to see someone who's qualified to do this, usually a board-certified plastic surgeon that will give their opinion about what can be done or what can't be done. One of the things that you'll find is as the patients get older into their 60s or 70s, perhaps the non-invasive ways to treat these like Botox and Juvederm may not be ideal or maybe cost prohibitive. Maybe you have to use so much of it that it gets very expensive. So perhaps those patients are better candidates for things such as eyelid lifts or brow lifts or facelifts instead.
All right, very well, doctor. Thank you very much for your time.
Thank you.